The Great Asthma Debate. 5 key questions. What is asthma? Is current drug treatment really working? Is there a safer alternative? How can asthma hospital emergencies be reduced? How can you escape asthma? Asthma sufferers are different. Asthmatics are physically different in many ways. Asthmatics have larger, more numerous cells which make mucus. Asthmatics have 5 times more mast cells than ordinary people, hence their allergic reactions are more severe. Asthmatics have stronger and thicker smooth muscles wrapped around airways. Asthmatics breathe 2 or 3 times more than usual when resting. But no two asthmatics have the same triggers, symptoms or reactions. Asthma means disease. Breathlessness, allergic reactions, lethargy, sinusitis, limited physical activity, high blood pressure, disturbed sleep, coughing, restricted living, snoring, days off sick from work, irritability, ruined sporting activity, depression, headaches, anxiety or panic attacks, blocked nose, dizziness, achy muscles, dry mouth, hay fever, just a few of the daily miseries of any asthmatic. Which of these are yours? What is asthma really? Well, there's no agreement amongst doctors. An article in The Lancet in 2006 questioned whether it was now time to get rid of this name because of this. So, symptomatic treatment. Because the underlying cause has been overlooked, all efforts have been directed at managing the asthma symptoms. The drug companies have enthusiastically given us an ever-increasing range of medications, all of which carry their own side effects that add further to the patient's misery and risk of serious illness or death. A number of recent drugs carry black box warnings signifying highest risk levels. Chronic hidden hyperventilation. Professor Buteyko proposed this was the main cause of asthma. Asthma is a condition that affects those genetically predisposed. Restrictions of airways, inflammation of airways, coughing, wheezing, sleep problems, increased mucus production, poor peak flow measures may be due primarily to chronic hidden hyperventilation. The question is, do you hyperventilate? Check your breathing now. Check your control pause. This is the maximum comfortable breath hold after exhaling. Measuring this control pause. Sit quietly to allow your breathing to settle. Take a gentle breath in, then after a gentle breath out, start a stopwatch or timer and hold your nose gently. Continue holding your breath until you feel the urge to breathe. Release your nose, breathe in gently through your nose and stop the stopwatch or timer. The control pause is the number of seconds of this comfortable breath hold. There should be no stress to this test. Your breathing should return to normal immediately after you release your nose. There is no larger in-breath after the breath hold. So, what does your control pause mean? If you measured between 45 and 60 seconds, you have excellent normal breathing. Between 35 and 45 seconds, mild hyperventilation. Between 25 and 35, significant hyperventilation. And between 15 and 25, serious hyperventilation, where most asthmatics are found. 5 to 15, very serious hyperventilation, and 0 to 5, critical, life-threatening. Back to basics. Let's consider, why do we breathe? The oxygen and carbon dioxide story. Every living thing needs carbon dioxide to survive. What keeps us breathing normally? Living on an alien planet. 250 million years ago, there was 6% of the air was carbon dioxide. Today it's less than 0.3–0.4%. Our lungs have become carbon dioxide tanks that have allowed us to survive on what now has become almost an alien planet. Our automatic control system, we produce far more carbon dioxide than we need. Our breathing rate is normally perfectly adjusted to remove just the right amount and leave us with between 5 and 6% in our lungs. But we have an automatic control system, and we produce far more carbon dioxide than we need. Our breathing rate is normally perfectly adjusted, and to remove just the right amount and leave us with between 5 and 6% in our lungs. But the automatic system can go wrong. Asthmatics breathe 2 or 3 times more than normal. So what's gone wrong? The story of our ancestors. Man was not the hunter, he was the prey, and to survive to today, we developed the fight-flight response to being attacked by a saber-toothed tiger. This was great for us in those days, but today it's not so useful, because any stressor, whether it's somebody cutting us up on the motorway, a telephone call, being ill, will produce the same fight-flight response, which produces overbreathing, amongst other things. The fight-flight response was not the hunter but the prey, and has always survived because of the fight-flight reaction. First sense of danger, the entire body is mobilized for maximum action. This includes increased breathing, ready for action. It used to be good to sense, but now modern man rarely reacts physically to such stimuli, but the body has prepared him for action despite that. Repeated unresolved stress reactions cause our CO2 receptors in our brain to accept a lower CO2 level as normal. We are then locked into chronic hidden hyperventilation. Hyperventilation lowers carbon dioxide levels in the body. But what happens to us when carbon dioxide levels fall? 3 major effects. First, the blood holds onto its oxygen more tightly, and less oxygen is given to the tissues. This is a brain scan of a healthy person breathing normally on the left, and then asked to breathe heavily just for 1 minute on the right. The red and yellow areas are high oxygen levels, and the blue and green low. And what's worse about this is that the oxygen is distributed to the higher center, to the essential organs, and not to the higher centers. So we can feel pretty bad when this happens. Secondly, smooth muscle spasms. All tubes in the body and hollow organs are surrounded by smooth muscle that twitch and spasm when carbon dioxide levels fall, causing, amongst other things, narrowing of airways and narrowing of blood vessels. It becomes more difficult to breathe normally. Thirdly, all the body's chemistry is slowed down as a normal acid-alkaline balance is disturbed. This affects the hormone production, insulin, calcium metabolism, thyroid function, cell energy metabolism, everything in the body. The problem and 3 possible solutions. We could avoid all triggers. That's a difficult solution. The second solution is suppress or palliate the symptoms, the medical drug solution. The third possible solution is learn to breathe normally, stop hyperventilating. This is the Buteyko solution. Let's look what modern asthma treatment and how it works, its positive and negative effects. A trigger or stressor causes us to hyperventilate because of the fight-flight response. The hyperventilation increases the mucus production, inflames the airways, and reduces carbon dioxide levels, which in turn causes spasm of smooth muscle, reduced tissue oxygenation. All these things put together producing all the symptoms of asthma. But we can then take a reliever medication, which opens the airways and acute symptoms are reduced. But on the downside, the breathing rate is increased due to the adrenaline in most relievers. So this increases the hyperventilation and makes the condition worse. In order to counteract this, we are given steroid preventers are used. This reduces the inflammation and our breathing is quietened. Symptoms are reduced, but the immune system may be suppressed by repeated use of steroids. So we are more prone to colds, chest infections and such like, which is one of the major triggers for most asthmatics. So would you like to take better control of your asthma with fewer drugs? Up to 90% less reliever medication and 50% less preventer medication. Less wheezing, less coughing, more energy, better sleep, and better quality of life. Your first steps start today. Be aware, more aware of your breathing. Keep your nose clear. Only breathe through your nose. Pace yourself so you can. Take time out to relax and breathe quieter. Check your progress daily with the control pause. Learn the Buteyko Method. Enroll on a Buteyko course. Asthma Care Kent breathing program. Are you ready for the Buteyko breathing program? Well, do you know why you have asthma? It's not what you think. Can you recognize the warning signs of an impending attack, and do you know how to prevent it? You will learn both of these vital things. Did you know you can reverse and even eliminate your asthma by correcting your breathing? This is what the Buteyko Method teaches. Do you know how and when to reduce or even eliminate medications and their usual side effects? This is part of the training. Do you know how to unblock your nose naturally at any time so you can breathe through it? We teach you how and why nose breathing is so important. Do you know how to exercise safely without fear of an attack? We'll teach you this. Do you know how to stop a coughing attack? Just another part of the training. Book your place on a one-to-one Skype training course. As these courses are live one-to-one sessions and the number of students is limited, every effort will be made to fit a date and time that is suitable for you. This we can discuss when you register. This gives a summary of the content of the training course. It will vary depending on each person's individual needs. This is part 1 of the registration form. And this is part 2 of the registration form. So what will you learn? What is a Buteyko breathing method? Why do you have asthma? How to recognize hyperventilation? How to correct breathing patterns? How to unblock your nose naturally? How to switch from mouth breathing to nasal breathing? Why it's so imperative to do so? Exercises to reverse overbreathing? Exercises to stop an asthma attack? Exercises to stop a coughing attack? Instructions on diet, lifestyle, stress, exercise, sport, and medication, sleeping. How to take better control of your asthma with less reliance on medications. You also receive resource information PDFs and a comprehensive training workbook. The Buteyko Method is suitable for all ages from 5 to 95, regardless of severity. You can read through some of these testimonials of past patients who have benefited from the Buteyko training. In fact, every asthmatic benefits to some degree or other. There's a lot of clinical proof behind the effectiveness of this, and these are some of the major trials. This is on top of the Russian trials which was extended over 20 years. Look at our website for more details. The Buteyko Method is endorsed by the British Thoracic Society as a valuable adjunct to all asthma therapy. So, why not act now? Free phone or email us. Make this year the year you take better control of your asthma for life. Phone or email me to discuss training options or to answer any questions you may still have. This is Michael Lingard, signing off.